Joining us right now to talk more about this is Dr. Scott Gottlieb. He's former FDA commissioner and a CNBC contributor. He also serves on the boards of both Pfizer and Illumina, and he's got a new book out this week called Uncontrolled Spread: Why COVID-19 Crushed Us and How We Can Defeat the Next Pandemic. Scott, let's go through this tick by tick. When you saw the recommendations from the CDC panel where they were narrowing what the FDA had kind of laid out and saying that not as many people could get boosters, what did you think?
I thought it was reminiscent of what they did with the initial authorization of the vaccines back in December when they came out with a schedule on who should be eligible for the vaccines and in what order. That was overly Byzantine and slowed the actual administration of the vaccines. It was so hard to follow the initial guidance. We forget that time period when they had these different categories, 1A, 1B, 1C, 1D, 2A, 2B. And they tried to narrowly define discrete populations of patients based on their own prioritization of need. And some governors started to ignore the CDC recommendation and just made it available on age. Governor Lamont here in Connecticut did that. He said that he'll give it to oldest citizens first and walk it down the age continuum. And that allowed Connecticut to deploy its vaccines much more quickly than many other states. DeSantis did that as well in Florida. So by keeping it simple, they were able to administer more vaccines. The same thing happened here, where I think the CDC got overly complex in defining these different categories, and they created a regime that was going to be very complex to administer at the pharmacy counter and probably would have disadvantaged people who already face obstacles getting access to care. They left some of those provisions in. So if you're 18 to 49 and you're not eligible under the occupational exposure provision, and you're eligible under the provision by which you have pre-existing medical conditions, they said that you still require consultation with a physician or some assessment of benefit risk, which implies consultation with a physician. So that's going to also leave in some complexity to these guidelines, even with the change by the director.
How is that even going to be managed by the pharmacies and other places that are giving these shots out? I mean, if you go to CVS, if you go to Rite Aid, if you go to Walgreens, they basically just ask, do you fit in these? And if you say yes, you go ahead with that. Will this require those people to actually have a note or a script from a doctor? I just don't even know how they manage it.
It's probably going to be self-attestation that you've had a conversation with a healthcare provider who judged you to be indicated for it based on your own assessment of benefit and risk, which means a lot of people are going to ignore the provision. And, the worst thing that you could do as a public health agency is put out provisions and guidelines that are going to be ignored. You want to make them practical so that providers and patients can adhere to them and will want to adhere to them. I think ultimately the director did the right thing overruling the advisory committee. Remember, it was a close vote as well. I think it was a 9-6 vote. So it wasn't like it was a resounding vote that people who are at risk from occupational exposure should be denied the boosters. So I think it was the right decision because there's a lot of healthcare workers who were vaccinated last December or January who are already getting boosters. There's also a lot of people who live in settings like prisons or assisted living facilities where they may not have underlying medical conditions, so they may not qualify that way. But the circumstances in which they live, we know puts them at high risk for breakthrough infections. And we are starting to see some bad outcomes in those settings. So I think that this aligns with where the public health really is going to require, some additional opportunity for people to get boosters.
Scott, my big concern is that this creates incredible confusion for anybody who's looking at this, trying to figure out if they should be getting the booster or not. The CDC chief overruling, you've said that this was a good idea. We just mentioned Dr. Jha saying it was a good idea. There are other people who are going to look at it and say, well, wait a second, this is the Biden administration overreach, and this is what the Democrats want. As a Republican who was appointed to lead the FDA by Donald Trump, what do you say to that?
Well, look, this is a lot of what I get into in the book. I think that we superimposed a system that was designed for peacetime. Basically, this system that we're seeing play out was designed to administer the pediatric vaccination schedule. That's primarily what they do. FDA approves vaccines for the pediatric population. CDC opines on whether or not it should go into the schedule, the mandatory schedule for childhood immunization. We took that scheme and thought that it would be applicable to a public health crisis. Really, what we should have done is reimagine that process and tried to get FDA and CDC in closer alignment, maybe in one seamless process, recognizing that if you had discrepancies between the two agencies, it was going to create confusion and it was going to create fodder for those who want to sow dissent and sow confusion. And that's exactly what's going to happen here. Critics are going to say that, look, these agencies can't even agree on who should be eligible for a vaccine. We told you that you shouldn't be getting a vaccine. So we shouldn't have allowed this process to go forward the way it has. I don't know why we assumed that processes built for peacetime would be good in a wartime setting of a global pandemic.